Hello everyone, you're watching sqadia.com and I'm Hammad Haider. Today our topic is the elbow fractures. We'll be discussing fractures around the elbow in both adults as well as in the children. We will have 5 sections. The first 3 sections we will be mainly discussing the fractures around the elbow joint in adults, which will be discussing the first section, the capitellum fractures, their clinical features, imaging and treatment. In the second section, we're discussing the Olecranon fractures, the clinical features, how to diagnose say Olecranon fracture, what is its classification, and how its treatment is done, and what are associated complications. In the third section, we're moving on to the simple elbow dislocation in adults, and what are the methods of close reduction of simple elbow dislocation. In the fourth and fifth section, we're moving on to the fractures of the elbow around the children. Especially, we'll be discussing the mechanism of injury, the pathology of injury, and how the injury occurs, especially role of the ligaments around the elbow in children. In the last section, we'll be discussing one of the most common fracture patterns, that is the supracondylar or the distal humerus fractures in the case of the children, which happen to be the most common form of injury around the elbow which occurs in the case of children. We'll be discussing the mechanism of injury, the pathology, clinical features and its diagnosis, along with its treatment and complications. Thank you very much. Keep watching sqadia.com.